How do healthcare options for Americans living in Europe compare to the US? Breaking news for Americans considering a move to Europe. The question that many are asking right now is how healthcare options for Americans living abroad stack up against those in the United States. If you are planning to live, work, or retire in Europe, this is crucial information for you. Let's break down the key differences in healthcare systems that could affect your experience. Americans living in Europe often find themselves navigating healthcare systems that differ significantly from what they are used to in the United States. Most European countries have public healthcare systems funded through taxes or social insurance. This means that residents can access essential medical services at low or no direct cost. For instance, in the United Kingdom, Americans may access the National Health Service if they meet visa requirements and pay the immigration health surcharge. In many European nations, public health care covers a wide range of services. This includes hospital care, doctor visits, and emergency treatment. However, some expatriates opt for private health insurance to avoid longer wait times or to access specific doctors. Private insurance can also be necessary for visa applications and may offer extra benefits like dental and vision care. International health insurance plans tailored for Americans living in Europe are also widely available. These plans typically cover inpatient and outpatient care, medical evacuation, and sometimes optional services like mental health support. Coverage can be customized based on individual needs, including worldwide options or excluding the United States. When comparing health care in Europe to the United States, it is important to note that the American system is largely private and insurance-based. This often leads to higher costs and complexity. In contrast, European public healthcare systems generally provide more straightforward access to care with lower out-of-pocket expenses. However, navigating these systems requires understanding local rules and registration processes. Americans are advised to research the specific healthcare system of their destination country. Utilizing expat-focused resources can be helpful. It is also wise to consider private insurance options for broader coverage and convenience. In summary, healthcare options for Americans in Europe often combine public healthcare access with private insurance for additional benefits. This approach contrasts with the structure and costs of the United States system. Many Americans living in Europe find this combination offers a more accessible and often more affordable healthcare experience.